medical standard of Taiwan has ranked as number 3 in the world and the first in Asia. In witness of the success, the roles of Taipei Veterans General Hospital are decisive.
I am Dr. Jennifer Jean Vicera. I chose Taipei Veterans General Hospital for fellowship training because Professor Xian Chen's electrophysiology team is a leading pioneer of radiofrequency ablation of atrial fibrillation.
Since 1998, this cardiac smear team have successfully completed thousands of atrial fibrillation ablation procedures with very low complication rates.
Our cardiac team has developed several new cardiac mechanisms and ablation techniques for treatment of atrial fibrillations. We helped many medical centers worldwide, including the United States, Japan, South Korea, Southeast Asia. For instance, to perform multiple complex cardiac ablation and set up their electrophysiological laboratories. Our EP team has also attracted hundreds of cardiologists for AF ablation clinical training. The abundant publications yielded from the related research have made our EP team constantly ranked among the top 3 in the world.
In the past 10 years, we have successfully cured thousands of patients with malignant bone tumors. The 5-year survival rate of osteosarcoma in patients without initial lung metastasis has reached 90.4%.
The innovative surgical techniques of biological reconstruction in limb salvage surgery are world famous. And the total amount of recycled autograft cases is number 1 around the world. Besides tumor surgery, we are also leading in the minimally invasive joint replacement surgery in Taiwan. The total case number has been more than 20,000 since 2001. The patients can have early functional recovery with less post-operative pain. Most patients do not need any walking assistance after the surgery.
Aside from pioneer innovation, we are one of the leading teaching hospitals in Taiwan to have the largest numbers of local students for placement training. We also open our arms to welcome and provide international students or practitioners with a tailor-made clinical training programs.
Center for Traditional Medicine is always favorable for international trainees in acupuncture and Chinese medicine. During the learning, we will offer lectures and practices on acupuncture, moxibustion, massage, cupping, and herbal drugs.
We also combine modern knowledge and equipment, such as pulse diagnosis, energy treatment, and laser acupunctures, to build into an integrated medicine to help patients relieve their suffering.
As a leading national medical center, we have the core missions of providing clinical services. But most important of all is effective education, that is to produce competent manpower for sure of patient care quality.
We provide a variety of training programs for the purpose of passing professionalism onto the younger generation. For the international applicants, it is equally essential to share cross-cultural experiences.
Pediatrics is one of the most popular courses among the international medical students, especially for those from Malaysia.
Together with local students, they will learn how to take integrated patient history, to perform physical examinations as well as evidence-based practice for children, to make tentative and differential diagnoses, and if available, to observe the interventional procedures, such as soft bronchoscopy and stent replacement.
Department of Medicine has many programs achieving their landmarks. In addition to the world-leading cardiac team, many other subspecialties are outstanding in their performance.
Yo actualmente me encuentro realizando mis estudios de tercer año de medicina interna en el Instituto Guatemalteco de Seguridad Social. Este es el Seguro Social de Guatemala y decidí venir a Taiwán porque tengo deseos de realizar una subespecialidad en gastroenterología y hepatología. Este país es conocido mundialmente porque cuenta con mucha tecnología y múltiples tratamientos para las enfermedades gastrointestinales. Es uno de los líderes a nivel mundial y se han realizado múltiples estudios para aprobación de ciertos medicamentos y realizar procedimientos en los.
Our headache team provides outpatient service for more than 2,000 new patients and admits more than 150 patients each year for diagnostic and therapeutic purposes.
This headache team plays a leading role in the Asia-Pacific region in treatment and research of primary and secondary headache disorders, such as migraine pathophysiology, reversible cerebral vasoconstriction syndromes, low-pressure headaches, and cluster headaches. It has attracted many international trainees, for example, from Japan, Korea, Australia, the Netherlands, and Southeast Asian countries.
Da Vinci minimally invasive surgery is widely used in general surgery, colorectal surgery, cardiac surgery, urology, gynecology, and other operations.
Cardiovascular surgery, CVS, is an amazing territory of surgery, attracting the largest number of international surgeons for clinical training. Aside from the variety of challenging and delicate cardiovascular operations, our CVS team members are reputed for aortic repair surgery, structural heart intervention, heart failure surgery, and peripheral vascular intervention. In summer 2015, all our surgical crews were mobilized for rescuing the victims of the color dust explosion incident that happened at Formosa Water Park. After months of efforts, we made a much lower mortality rate than that of the nationwide average, and even lower than those similar cases in Europe and North America, adding to another medical miracle in Taiwan. Comprising the clinical diagnosis, surgery, pathology, and aesthetics, dermatology is always the target specialty, attracting students from various countries. We provide vivid and active learning activities, including case challenge, histopathological discussion, dermatological surgery teaching, and cosmetic procedure observation.
In the Department of Obstetrics and Gynecology, we performed more than 1,000 cases of minimal invasive surgery, including body surgery. In addition, for the urogynecology field, we also perform more than 300 cases of urogynecology surgery every year.
Our REI program is one of the top in the nation, and we are a referral hospital for high-risk pregnancy. We have a friendly and comprehensive teaching and training program for intern, residents, and fellows.
For the past 5 years, a total of 117 international medical students attended the clerkship trainings on emergency medicine, making an average of 24 annually. Emergency medicine is among the top 3 courses voted by international trainees.
An annual population of 80,000 patients makes teaching available everywhere because of the diverse and complex clinical scenarios. Trainees are able to learn at bedside, to attend morning and weekly pitfall meetings, and to rotate at our resuscitation room, trauma area, and observation area for case-based discussion. Teaching rounds are prepared with various topics such as toxicology, simulation-based team resource management, and mass casualty drills, just to name a few.
We are in good cooperation with some of Taiwan's partner countries. Currently, we have an ongoing project to work with the Federation of St. Christopher and Nevis on the prevention and control of chronic kidney disease.
We invited 6 seed instructors, including doctors and nurses, to visit our hospital for 1 month. Having received training and working together for the holistic care of patients at different stages of chronic kidney diseases.
They have very much experience on working on cancer registry and working on oncology and non-communicable disease. Well, my first impression of Taiwan is like a beautiful city. You have kind people, very good food. I feel like you're going to be my family the time I'm going to be here.
Finally, let me welcome you again to join this big family of Taipei Veterans General Hospital. You will empower and enjoy the training here as much as I do.